Okay, so we're going to give you an example of how a fear-free visit would work for a kitty that's coming in for an exam. This is Dexter, and Dexter is actually from the Waupaca County Humane Society. He's my kitty. He volunteered to be a kitty here today. He's actually very good. He's good at car rides, and he's good at showing us. So you can see now we've got the carrier ready, and Emily's going to take the lid off. So now our cat hasn't even moved. He hasn't gotten shaken out of the carrier. He's not scared. He's pretty personable, so he'll come on out and be with us. Now, if I wanted to do my exam at this point and I had a nervous kitty, I can do it right in the carrier. I can get in and I can listen to his heart, so I can come in this way. Such a good boy. I can actually get a good exam of his mouth if I want to do that, so I can look at his teeth and see if he has any dental issues. I can certainly check his eyes if I need to do that, so I can come in with an ophthalmoscope so that I can see his eyes, and then I can also use my otoscope and check his ears. These are all just parts of a thorough exam so that we know that everything is okay with him. And again, you can see he's not tremendously stressed by this. I can palpate him. I can even palpate his abdomen. So I can do everything in the carrier. Now, if there was something I couldn't do in the carrier, I can take him out, and we'll move that. And now we have him on a towel and a rubber mat, because anytime that the cats are sliding or skidding, they're nervous. So we try to make it so they feel very confident in the surface that they're on. And again, he's super good. He's gonna let me do anything I want. But if he was a little bit nervous, Emily's gonna show you what she would do so that she could wrap him and I could still examine him. Interestingly, cats don't really like to be held and touched when they're nervous. And so she's gonna wrap him in such a way that the towel is holding him and not her hands, so he doesn't feel restrained by a person. And I think you can appreciate that. If you were nervous, somebody putting your hands around, or their hands around your neck would not be as comfortable as maybe putting a piece of cloth around you. So now he's wrapped, so we could do whatever we need. And with this technique, if I need to draw blood, a lot of times we'll use a black leg. See, I can even position him so that I can get a blood sample without him being upset at all. So again, our goal is for our kitties, at least here, that they're not scared, they're not hurt, and they're not anxious during their visits. Now that we told you a little bit about how to get our kitties here, how to minimize their stress, and how to make this a good visit for them, as well as what we're going to be doing, now let's talk about why veterinary visits are important for our cats. Everybody knows that cats, from the time they're about a year old until they're about 10, most cats go along just fine. They may have issues, but they are silent issues, and they're issues that you might not know at home. And there's things that you wouldn't normally look at. So when I do an exam, I'm always going to listen to their hearts. There's a significant number of kitties out there that have heart disease, and they may have a heart murmur or an enlarged heart or a condition called cardiomyopathy. Diagnosing those diseases early is very helpful. Sometimes they have ear issues, and looking at the outside of their ear, you can't tell, but when you take an otoscope and look all the way down, you can see that actually they have a polyp, a growth in their ear, or they have a ruptured eardrum, or they have an ear infection. Animals that have long-standing ear infections often don't show what you would think would be appropriate signs. They're not doing a lot of scratching or shaking their head because they've had it their whole lives. Cats can get tumors in their eyes, and they can also get eye issues, so we always want to look at that. And one of the most important things is dental care for cats. Cats get a condition called feline oral resorptive lesions, which are almost like cavities on their teeth, and they erode the entire tooth away. It can be one tooth or multiple teeth. They're very painful. And a cat has no way of telling us that, because unless the mouth is so severe that they just can't chew, they will simply chew on a different side, or they will prefer soft food, or they will even swallow their hard food whole. And you don't have any idea that this pet is in discomfort because they have no way to let you know. So this is all very important that we know what's going on so that we can hopefully keep them healthy their whole lives. Starting at about age 7, or even sooner with young wellness panels, we're going to be talking to people about wellness lab work. And you would be surprised how many times we find a problem before it's a problem. So if we find an early kidney issue, if we find a thyroid problem or a glucose issue, anything, if we find it early, we have a much better chance of controlling it and treating it. So we like to find that. Periodically, we'll have somebody bring in a senior kitty, maybe is 14 or 15 years old, very, very thin, very, very sick. has never been to the vet, is presented for euthanasia, and they say, well, we knew there was really nothing that could be done. And I always feel sad because there may have very well been things we could have done had we known the issue was happening and had we intervened medically early on. So, cats, again, sometimes get overlooked just because they're not walking at our sides, but they're very important to provide veterinary care for and to keep healthy.